The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and today I'm going to talk about sinusitis. All my videos are directly referenced from the US National Medical Library, so you can trust the information. So what is sinusitis? Why do you get sinus headaches? Why you get headaches in cold weather? Why do you sneeze all the time? Why do you get all these sinus blocks, right? So what is the fuss about it? What are the symptoms? What is the treatment? What are the tests? Let's talk about sinusitis in all the details possible. So sinusitis is present when the tissue lining the sinuses becomes swollen or inflamed. So there are a lot of sinus in your face, right? And it occurs as a result of infection from a virus or a bacteria or a fungus. So that's the thing. What you have are two frontal sinuses. There are two ethmoidal sinuses here in between, and there is two maxillary sinuses here. Two maxillary, ethmoidal and frontal sinuses. If these sinuses get inflamed or swollen because of infection, virus, bacteria, fungus, you'll have sinusitis. So what is the cause? Basically, these air-filled spaces are there, and healthy sinuses, they don't contain any bacteria or even any germs, right? Most of the times there is mucus which is inside these sinuses or in the walls, which is able to drain out, and air is able to flow into the sinuses, right? So mucus is able to drain out through the exits, and basically sinuses are filled with air. When the sinus opening becomes blocked, or if there is too much mucus buildup, then the bacteria and germs can actually grow inside very easily. So sinusitis can occur because of three conditions. First, either there is the small hairs which are called cilia inside the sinuses, they fail to propel the mucus out. Their function is to continuously push out the mucus. So if this happens, this may be due to some medical condition. The second condition, if you have cold or other kind of allergies, if you have colds, if you get cold, infection or allergic reaction, then this can also cause too much mucus, right, production. So a lot of mucus is produced, so which blocks the opening of the sinus, and you have sinusitis. Then there might be deviated nasal septum. The middle septum of the nose can be deviated. There might be a nasal bone spur, nasal polyp, or anything like that inside the nose which may be blocking the opening of the sinus, right? So when this thing happens, right, there you will have sinusitis. So the sinus gets filled with mucus, and even sometimes bacteria, they thrive inside. Okay, so when the bacteria, there will be pain and other symptoms. So we'll come to that. But there are two basic types of sinusitis. First is acute sinusitis, in which the symptoms are present for 4 weeks or less. 4 weeks or less, it's acute. It's called is mostly caused by bacteria growing inside the sinus. Then there are chronic sinusitis, when the swelling of the sinus is present for longer than 3 months. This may be because of a bacteria or a fungus, right? Then you might have a higher risk of developing a sinusitis if you have some, let's say, allergic rhinitis, if you have hay fever, cystic fibrosis, if you are going to a daycare, right? And if diseases that you have a disease that actually prevent the cilia from working properly, you have changes in altitude if you're flying or scuba diving, if you have a large adenoids are also glands Then smoking, if you smoke, if you have abnormal sinus structures, if you have weak immune system, like if you're on chemotherapy or have HIV infections, like that. So you will have increased chances of sinusitis. So if you do have sinusitis, what will happen? Obviously, in acute sinusitis, adults very often come after a cold, right? That does not get better or even gets worse after 5 to 7 days, and symptoms will include something like cough or bad breath or loss of smell, or even worse cough at night, then fatigue, fever, headache, generalized feeling of being ill. Then there might be pressure like pain behind the eyes, toothache. There can be tenderness on the face, nasal stuffiness, discharge, sore throat, post nasal drip. All these things can happen. I mean, some combination can happen. It's not necessary that everything will happen on one person. A different combination can happen depending upon what kind of sinus is involved, which one, right? Then symptoms of chronic sinusitis can be same for those like acute, but however, the symptoms tend to be milder, right, in chronic sinusitis, and they last longer than 12 weeks. Symptoms will last longer than 12 weeks, and that's the how we diagnose chronic sinusitis. Then that's the symptom. Then what is the symptom of sinusitis in children? In children, they might have cold or respiratory illness that has been getting better, and then suddenly begins to get worse. So in children, they will have cold or respiratory illness that might be getting better and then becomes worse. They might have high fever, they might have fever along with darkened nasal discharge, which might last for 3 days, at least 3 days. Nasal discharge can occur with or without cough. That's not necessary. Nasal discharge is important, and nasal discharge needs to be present for more than 10 days, and if it is not improving, that means they have sinusitis in children. So how can we diagnose? What are the tests? The doctors will first look into the nose for signs of a polyp, deviated nasal septum, or etc. etc. Then they will shine a light against the sinus, right? That's the trans illumination test, signs for inflammation. Then they might tap over a sinus area to find the tenderness or infection, right? Then the doctor can also view the sinus through a fiber optic scope. This is called nasal endoscope or rhinoscope. This is basically to diagnose sinusitis. This is often done by a ENT specialist, ear, nose, throat specialist, and many times imaging tests are needed, including X-ray, PNS views, or CT scan can be done for the sinuses to diagnose sinusitis or view the bones or tissues very closely. MRI can also be done if to see if there are any tumors or fungal infections. Then most of the times regular X-ray of the sinus can also diagnose sinusitis, but sometimes it might not diagnose very well. All right, that's why CT scans are needed. So if you or your child has sinusitis that do not go away or keep returning, then you might be asked to do some tests like allergy testing, blood tests for pure immune function, ciliary function test, nasal cultures, nasal cytologies, sweat chloride test for cystic fibrosis. All these tests are special tests only done if chronic sinusitis is there and it's not getting better. Then coming on to the treatment, right? First of all, let's understand how you can take care of yourself. First, you need to apply warm or moist wash cloth on your face several times a day. Warm, moist cloth, right? That's what you need to do. Drink plenty of water, right, which actually thins the mucus and helps draining out the sinus. That might be the biggest cure sometimes. Then you need to inhale steam 2 to 4 times a day. For example, while sitting in the bathroom, you can do that. in the bathroom while running shower. You can spray with nasal saline several times a day. You can use a humidifier. You can use a saline squeeze bottle to sometimes flush the sinuses also. But be careful with the use of over-the-counter nasal spray decongestants, right? Such as Otrivin or oxymetazoline, right? So, or sometimes, or also neosynphrine, neosynphrine. They will help. They might help at first, but if you keep using them for a long time, more than 3 to 5 days, they can actually make the nasal stuffiness worse. All right. So remember that. Then, to help ease the sinus pain or pressure, avoid flying when you have congestion. Avoid temperature extremes like sudden changes in temperature, bending forwards with head down. Avoid those things, right? You can try acetaminophen, paracetamol, or ibuprofen if you have pain. Then other medicines which can be used, most of the times antibiotics are not needed for acute sinusitis. Most of these infections go away on their own. Even when the antibiotics are prescribed, they help, but they might only slightly reduce the time it takes for the infection to go away. Antibiotics are more likely to be prescribed only if your child has nasal discharge and possibly with a cough, or which is not getting better for at least 2 to 3 weeks, or if they have fever more than 102 degree Fahrenheit, 39 degrees Celsius, if they have headache or pain in the face, if they have severe swelling around the eyes, all these reasons are there to prescribe antibiotics. Then acute sinusitis should be treated for 10 to 14 days, right? That is the duration. Chronic sinusitis needs treatment for 3 to 4 weeks, almost a month, right? And some people with chronic sinusitis may need special medicines to treat fungal infection, right? But at some point, your doctor will consider prescription medicines, more tests, or referral to a ENT specialist, right? ENT specialist, ear, nose, throat specialists are the best doctor for this kind of situation. Then other type of things which you need to consider are allergy shots. If you have like severe allergic reactions, then you can see my allergy video for what is allergy shots, right? You need to avoid those allergy triggers. You might take nasal steroid sprays, antihistamines to actually decrease swelling, especially if there is a nasal polyp or nasal allergy like rhinitis. Then surgeries may be done to enlarge the sinus opening and drain the sinus. Then it might be done to remove the nasal polyp or deviated nasal septum. And surgery is only considered if symptoms do not go away for 3 months. If your symptoms, if you have like acute sinusitis for more than 2 to 3 episodes every year, if you have that every year for 2 to 3 times, then you might consider surgery. Or if you have fungal infections, right? Surgery can be done to, as I said, to repair the nasal structure, or deviated nasal septum can be repaired, nasal polyp can be removed from your body, right? Then most of the times sinusitis can be cured with self-care itself and a little medical treatment. But if you are having repeated attacks, you should obviously get it checked by a ENT specialist, right? Then if you don't get treatment at all, the problems may increase to an abscess. Sometimes you might have infection going into the bone. Many osteomyelitis can happen. Infection might go into the brain. Meningitis infection can actually go into the eyes also, or vital cellulitis can happen. So if you have symptoms which are staying there for more than 10 to 12 days, 20 to 14 days, if you have a cold which is getting worse after 7 days, then you should go to a doctor. If you have severe headache, it's not getting relief by medicine, if you have fever, if you have like symptoms, if you are even after taking all your prescribed medicines, antibiotics properly, or if you have any changes in your vision, right? During a sinus infection, that's a sign when you need to go to a doctor again, right? A green or yellow discharge does not mean that you definitely have sinus infection or you need antibiotics. That's quite, routine in sometimes, right? Green or yellow discharge is not an alarming sign. Then, can you do something to prevent it? Yes, the best way to prevent sinusitis is to avoid cold or flu, or if you do get cold flu, then treat it properly and quickly, right? Drink plenty of water, eat plenty of fruits and vegetables which are rich in antioxidants and their chemicals that could be actually boost your immune system and help your body resist infection. Then you can get an influenza vaccine every year. Then reduce stress, exercise, wash your hands, often particularly after shaking hands with others, because it's very common in cold weather to actually get the infection from others. Then other things which you can do is avoid smoking, or even avoid going out into pollution, on traffic, in dust storms, right? Drink plenty of water, as I said, to keep your mucus moist. Take steams, take decongestants during the upper respiratory infection, and take allergies, right? If you do have allergy, treat them quickly. Treat allergies quickly. Use a humidifier to increase moisture in the nose or sinus. So that's all you can do for a sinusitis. That's complete that the information about sinusitis. I hope the information was helpful. Do share this video, do like, subscribe, hit the bell icon, and let me know how you feel about this video. I'm Dr. Paramjeet. You're watching Doctor Education. Don't forget to promote my channel. It's your channel. It's for education. Do let me know if you want me to make a video about certain topics. I'll definitely consider. So thank you so much, guys. All you need to do to stay healthy is stay connected.